This episode is based on a true story. Some scenes have been dramatized. Always consult your doctor for medical advice.
Here in the land of two seas, Bahrain, healthcare is one of the priorities in the kingdom. Health, as we all know, is important for human happiness and our well-being. And at Health Hub, we answer your common questions and bring to you information about the advanced medical facilities in Bahrain. In today's episode,
tell us about sleep apnea. What is sleep apnea?
Today we'll be doing a sleep study for you.
Sleep is absolutely essential for us humans to function and get through our days. Some of us, though, despite getting 6+ hours of sleep at night, still feel tired and groggy. I'm Dr. Khawla, and in this episode, we will discuss these issues relating to sleep. Right now, I'm headed to see Dr. Rashu, an ENT and sleep disorder specialist, to talk to him about one of the most common sleep disorders, and that is sleep apnea. Good morning, Dr. Rashu. How are you?
Hi, good morning. I'm good, thank you. How are you?
Good to see you. Thank you.
Yeah.
Tell us about sleep apnea. What is sleep apnea?
Okay, if we simply say apnea, that means somebody is not breathing. But when somebody is not breathing during sleep, it's called sleep apnea.
I see. What are the main symptoms of sleep apnea?
See, very common things people have there in their life is like loud snoring at night. Sometimes they're feeling like as if they are not breathing or gasping. And in the daytime, they feel very fatigued, unrefreshing, morning headaches, like that. So there is a long list of the symptoms. Yeah.
Very good, very good. I understand we have a patient.
Oh yes, I have one patient who is suffering from all these symptoms. Let's come and see him.
Let's go. Thanks.
Hi, good morning, Mr. Karim.
Good morning, doctor. How are you?
I'm
Fine,
good,
thank
Good
you.
morning.
Good morning, doctor.
Okay, Karim, tell me, what are the problems you're having?
My problem is during the sleep, I feel choked. I wake up frequently, and when I wake up to drink water, go to the toilet, I cannot sleep anymore. That's during the sleep. And when I wake up in the morning, I feel fatigue, body pain, headache. I cannot concentrate at my work. Even while driving, I feel sleepy, So all this brought me here to you, doctor.
Okay, so roughly how many years or like months you are having these problems?
I have it for a long time, doctor, but the thing is, I thought it's normal, and I kept on continuing sleeping, and I thought I'll get better sleep, but eventually it did not, and I felt to seek for doctor's help.
Okay, now I get it. So like just to confirm what kind of sleep apnea you have usually, which is obstructed type, I need to examine your nose and throat to see like if there is something which is blocking your throat so that oxygen is not going inside during your sleeping. So shall I go for the examination?
Sure, doctor.
Okay, thank you.
So, Dr. Rashu, while you're preparing, can you tell us what happens if someone leaves their sleep apnea untreated?
Now there are a lot of study that people who have sleep apnea and don't get treated, they have very high incidences of having diabetes, like heart attacks, strokes, work accident, like they're driving, they can catch into some accidents. And of course, there are many more things like memory related issues. So people grow really older very fast. And with some of the data from the US, people are losing almost 5 to 10 years of their life if they don't treat sleep apnea. Yeah. So now I'm going for the examination. Okay. Yeah, please keep your head on the back. Give me tongue depressor. Please open your mouth. Keep your tongue inside. Okay, let me check your nose. So what I can see in your nose, that you have the bone in the middle, which is bending too much on one side. So this bending of the bone to one side block your nose too much. And the second thing, you have these turbinates inside the nose. So again, because of allergic reaction, they are looking quite boggy and big. So together, this blockage in the nose, because of deviated bone and this turbinate thing, I think the air is not going very well inside in your throat. but I still need to examine a little bit more. For that, what I'm going to do is I'm going to pass a small endoscope with a camera inside, and then I will see if there is something in the throat which is blocking your area for breathing. So shall I go for that?
Please, doctor.
Okay, thank you.
So it sounds like, maybe problems with the nose even can
Yeah.
cause or
Right.
aggravate
Right,
that.
right. Because the problem can start from the tip of nose up to the lungs. So anywhere there is a blockage, it can contribute to the sleep apnea. Okay, fine. So give me the endoscope, please. I'll go straight away. You can keep your head on the back. Yeah. So here we are inside the nose. Okay, so can you see there on the screen, Dr. Khala, that he has very big tonsils, and when he is trying to breathe, these tonsils coming like kissing
this.
each other. So they are practically closing his throat
I see.
as if he can't breathe very well from the. Okay, so I already seen that there is a good amount of blockage in the throat as well. Okay, Mr. Kareem, as we have already seen that you have blockage in the nose and throat, which show me that there is some good amount of obstruction for breathing. But to confirm like what is the severity of the problem, probably I will do a standard sleep test for you, which will give me more information about your problem.
Okay, doctor. Sounds
Okay.
good.
So Dr. Rashu, tell us about this sleep study. Why is it important to do it in Kareem's case?
Okay, as if in every patient who has the sleep related issues, we have to do some tests when the patient is naturally sleeping. So we are taking advantage of the same phenomena that we will put some electrode over the chest, over the neck, on the forehead to see the activity of the brain and the heart and the lungs during breathing. So this will give us a complete idea as if what problems are going during the sleep.
I see.
And we will record them.
Very
Yep.
good, very good. So it's like he's sleeping at home, and so you're seeing what's happening at home, but rather in a more controlled setting, like
Exactly,
a lab.
exactly.
Okay, good to know, good to know. Very good. So then I will come and see you, Kareem, and also Dr. Rashu tomorrow after the sleep study is done.
Right.
Okay.
Okay,
Good to
doctor.
see you.
You
Good to
too.
see
Thank you.
Thank you,
Thank you,
Dr.
doctor.
Rashu. Thank you.
Thank you.
Hi, good evening, Mr. Karim.
Good evening.
How are you, sir?
Fine, thank you.
My name is Arpan and I'm the sleep technician. Today we'll be doing a sleep study for you and we'll be fixing a small device on you and some electrodes. Nothing to worry about. Just relax and you have to sleep the normal way you do every night. And this device will record all your parameters during your sleep. And after the sleep study is done, the doctor will be evaluating your report and he will be discussing with you about the further course of action.
Okay.
So I'll be, with your permission, I will start with the sleep study now.
Please.
Yeah, thank you so much. I'm done. Now you can sleep and when in the morning when you wake up, I'll remove everything and we will send the data to the doctor.
Thank you very much.
Thank you for your cooperation. Thank you for being so patient. Have a good night's sleep, sir.
Hello again, Dr. Rashu.
Hi,
How
Dr.
are
Khala. I'm good, thank you. How are you?
you? Good, good. How was Mr. Kareem's night?
Okay, I think we are going to see him right on the sleep study itself. So before taking his sleep study, I'll just show you what all we see in the sleep study, that there are various parameters. You already saw we were putting lots of electrode. So they are basically recording the brain activity, the heart activity, the movement of the chest while he's breathing. And then normally the airflow should be like a bell shape. But now you can see some straight lines So basically these are the time when Kareem is not taking breathing, or somebody who is with sleep apnea is not breathing.
It's kind of
So-
like the chest movement. So
Exactly,
the chest should
exactly.
move like that. When it stops moving,
Right.
it's apnea.
Right. So that's what is called as apnea. So any episode of not breathing for more than 10 seconds is recorded by the machine. So now we can come to the Kareem study. Okay, so this basically is the compilation of his study, because this study is almost for 6 hours. So we calculate the result for this. So the most important thing which we look into the study is this AHI index. So what we call it as apnea hypopnea index. What does it mean? Like in 1 hour, Kareem is not breathing almost 28 times.
That's a lot.
Yeah, and these all events are those episodes which are more than 10 seconds. So for
Yeah, I guess how many episodes would you expect for a normal person?
it should be less than 5, then it is considered to be the normal, but in his case it's almost coming like to be a severe kind of a sleep apnea. And not only this, we can see few more things. So one more thing I would like to say is it's not just about the quantity of the sleep but the quality of the sleep. So sleep has got various cycles, the light sleep and the deeper sleep. In Kareem's case, you can see this N3 is, which is called the deep sleep, is almost absent.
0%.
Yeah, so this is the most important sleep where body try to restore all the damage.
What about REM sleep? We always hear about the dream part of the sleep.
Exactly, so even the REM sleep is also reduced, and of the whole sleep duration. So REM cycle again is like the deeper part of the sleep where the patient eye is moving, but he's actually in a very deep phases. So in Kareem's case, even the REM sleep is also reduced to a greater extent. And one last thing which I would like to highlight is the oxygen level in the body, which usually remains like more than 90%, if not 100. But in Kareem's case, you can say the minimum saturation is going up to 70%.
That's very low.
That's very low. So that's the reason that he was complaining of all those tiredness, feeling of unrefreshness, and multiple things like blood pressure and diabetes, because all the blood organs are basically acting on the oxygens.
And every time the apnea occurs, the oxygen can drop.
Exactly. So this is what happening every time in a patient with sleep apnea.
So for this type of sleep apnea that's very severe, what are the treatment options?
Okay, so I can probably show you with a graphic presentation. Okay, so here we go. So basically there are multiple treatment options for the sleep apnea. The traditional, which is non-invasive type of, so treatment we call that the CPAP machine. So patient wear a face mask where the oxygen keep on coming. The only problem is like the patient has to wear it every night for rest of their life.
Right, and I think the partner is usually the one bothered.
Exactly. In Kareem's case also, like he had large tonsils which are seated in the throat on both the side. So taking advantage of the coblation thing, which is almost a bloodless technology, we can take off both the tonsil.
Very informative, thank you. So now what about Kareem? What are we going to do for him?
So probably looking at his profile with the severity of the sleep apnea and sleep study, and in the endoscopy we have seen, we are going to do a modified techniques which are the advanced sleep apnea surgery, something called as relocation pharyngoplasty and palatal suspension. We are going to take off the big structure involving tonsils and the epiglottis and going to fix them to a newer position. So it will keep his throat open, at the same time not giving any complication or side effects.
So basically widen his pipes.
Exactly.
It's very good to know. Thank you. Appreciate it.
You're welcome. Hi, good morning, Mr. Kareem.
Good morning, doctor.
How are you?
Fine, thank you.
So ready for the surgery?
Yes, ready.
Okay, I'm sure this thing is going to be great for us. Okay, so just stay relaxed, see you inside. Okay?
See you.
Yeah, let's go inside. Please. Hi, Mr. Kareem.
Hello, doctor.
How are you?
Fine, thank you. How are you?
So it's already been 1 month now after your
Almost.
surgery.
Yes.
So will you tell me how you are recovering?
The recovering was, as you promised, from 2 to 3 weeks. I totally recovered, and I have whatever food I could have normally without any issues.
That's great. So maybe we can talk about like the issue you used to have regarding your sleep thing. So you were not sleeping properly and used to have unrefreshing kind of an
So
sleep.
at the moment, I sleep continuously for 8 hours, or I wake up once just to drink water and go back to sleep deeply without any issues.
And I believe this unrefreshing sleep or like tiredness was affecting your life in terms of your diabetes, blood pressure, thyroid.
Blood pressure, diabetes, and so many other things. And now when I go to do my regular checkup, everything is back to normal without any pills, without any medication. So I'm very grateful.
Did you know that having a thick neck can predispose someone to obstructive sleep apnea? More specifically, if your neck circumference is over 16 inches for women or 17 inches for men, that by itself increases the risk for sleep apnea significantly. What about body weight? Body weight, and more specifically obesity, can also increase your risk for sleep apnea. And losing as little as 7 to 10% of your body weight can significantly elevate and improve the sleep apnea and your quality of life. Right now, I'm headed to see Dr. Rashu and Kareem as well to check on his progress 1 month after his surgery.
Okay, that's
Sorry
great.
to interrupt everyone.
Hi,
Hi,
Dr.
Mr.
Khan.
Kareem.
Hello,
Hi,
Doctor.
Dr. Rashu.
Hi.
Good to see you again, both.
Same
You
here.
too.
Yeah.
How are things going?
Things back to normal as it was, before having the sleep apnea. So as I was explaining to the doctor, my blood pressure, my sugar levels, all back to normal without any medication. Again, my mood swing, memory fog, all that is gone. So I'm really thankful for the doctor to do this operation.
So sleep, I mean, is really important, right? It controls, the things that we consciously feel, like energy and mood, and the things we don't feel, like blood sugar and pressure and all of that.
Exactly.
Wow. Okay, so I heard that Kareem just had an endoscope, a repeat one?
Right. So probably today we can run the endoscopy which was done immediately before the surgery to show like how was his throat reacting and the oxygen was not reaching well. Okay. So this is his endoscopy immediately before surgery.
And what we're seeing are?
So basically this is his uvula, a large structure in the mouth, and then the big tonsils which are almost closing his mouth while he's trying to take oxygen. So this way like the oxygen does not reaches to the lungs downstairs. So that was the real issue, that without oxygen he was feeling not fresh. And probably now we are going to look for the endoscopy which we have done. So you can see there. Now the throat is widely open. Even if he's trying to take the air, the throat is not collapsing like before.
And we don't hear snoring anymore.
Yeah, exactly. Even if there is a snoring, it's very, very minor in intensity. So I think it's a significant change we have made before
Remarkable.
as well as after the surgery.
That's great. And the images mirror how you feel as well.
Exactly, yes.
Very good.
So I think like this thing will continue with you in terms of your health issues, and I wish you all good luck and best wishes.
Thank you very much.
Yeah.
Thank you. Wish you the same.
We all
Thank
do.
you, doctor.
Thank you. The problem with sleep apnea is it is more like a hidden thing. People don't pay too much attention, like patients who have diabetes or patient have hypertension or other medical problem. So it more look like a hidden problem. Alone in US, almost 4% of their population is already having severe obstructed sleep apnea, although there are no documented data for Bahrain. But as per the clinic visit, I have lots of patients coming every week with different way of presentation for their sleep apnea.
It started with my daughter. She used to snore and wake up. I feel she's suffocating. It was horrible looking at my daughter like this. So I took a video and showed it to the doctor. He said definitely, most probably, she got sleep apnea. But when we brought our daughter over there, he did some checks on her. Then she confirmed that she got sleep apnea, and then it escalated to me and my other family members and friends as well.
So initially people feel embarrassed about that they are making big snoring, but let's consider or compare it with the same way like we are wearing glasses or wearing hearing aid. It might look embarrassing in the beginning, but later on it improve your quality of life. So in the same way, I would message all the people who might have snoring or sleep apnea to first come have a visit so that we can find a solution. I'm sure like people will come back to say thanks once this problem is settled in terms of their snoring and their symptoms, and not only them but their family as well.
During the sleep apnea, I used to have limited time to spend it with my family because all the time I was fatigued and sleeping during the day and night. But after I did the operation, I get enough sleep so I could spend some time for myself, spend it on my hobbies, on my families.
Every week at Health Hub, our team brings you the latest and most relevant information to your health. I'm Dr. Khawla, and I'll see you next week.